Hi, I'm Lori Handy. I'll be speaking to you today from the Vaccine Education Center at Children's Hospital of Philadelphia. Today we'll be talking about why the dengue vaccine has specific recommendations for a small group of children. To begin with, let's talk about what dengue disease is. It's a disease that's actually caused by 4 very closely related viruses called dengue 1, 2, 3, and 4. What this means is that individuals can actually get infected up to 4 times in their life. When people initially get this disease, they may have a mild illness, something like an acute onset of fever, vomiting, fatigue, muscle aches. Likely they'll have a rash a few days into their illness. Many people will be able to recover quite easily. However, there is a phenomenon called severe dengue. This is when people lose so much fluid that they can have bleeding, shock, or even need care in an intensive care unit. We most commonly see severe dengue when people are experiencing their second infection, meaning they had a first infection, they developed an immune response, and then later in life had an infection a second time. This phenomenon is called antibody-dependent enhancement, meaning the person's own immune system actually helped the second infection be more severe. When using the dengue vaccine, what we're actually trying to do is prevent that second infection, or that third or fourth. So we use this vaccine in individuals who had already had a first documented infection. When we use the vaccine in this way, we're actually able to reduce that second severe infection. There's something really important to realize here though. If somebody who's never had a dengue infection receives a vaccine, they are at risk for that same phenomenon for their first infection occurring after the vaccine. This is again why it's so critical somebody has already tested positive for a dengue infection before they receive their vaccine series. Similarly, we only recommend this vaccine for individuals who are at risk for repeated infections. Those at risk are really people who live in areas where the viruses are endemic, meaning the viruses live there all the time. In the United States, we really think mainly about Puerto Rico, as well as some of the US territories. The final piece of this is what age child is this vaccine recommended? Many people know that this is just recommended for children ages 9 to 16. Why is the recommendation written this way? Well, for one, children under age 9 are less likely to have already had a dengue infection, and for that reason, we would not want to be giving them vaccine. The upper age limit of 16 is designed because this is where the vaccine is best studied, and we don't have data to support use over age 16. So, in summary, this vaccine is really for those children ages 9 to 16 who have already had a prior dengue infection documented by blood work and who continue to live in areas where the virus is endemic. Thank you for taking the time to listen today.